dental implants, really the most important thing that can affect the cost of dental implants is how many is that doctor doing? The more a doctor does, usually the less expensive it can be. And I know it might sound crazy, the more you do, you should charge more, but the more implants that I do in my practice, because I have to buy those implants, I can give them to you cheaper. So the more I'm doing, the better for my patients. So if you find somebody who's not doing this all this often, typically they're gonna have to charge you more because they don't do it as often. Other thing is, do they have their own dental lab? The other side of a dental implant is you have to put a tooth on it. So the other side that can cost the patient is what costs the dentist to put a restoration on top of that. So ask the office when you call them, do you guys have your own lab? Do you make the teeth in-house? That should be a key to you, that if they say yes, they can keep the cost down because they're not paying an outside lab for something. They're doing it in-house. The other thing is just for patients is financing. For me in my practice, if a patient can come in and we don't have to worry about financing and the hassle that goes with it, we can also keep the cost down for our patients as well. So we offer multiple financing options for our patients here in this office. Some are third-party financings that we use, but we also are good about working with the patient within their own financing. We've had patients that have used their 401k and done loans against them, home equity loans, and we try to help navigate that for our patients as well as our internal third-party financing. Another thing that we do for our patients is insurance. Implants are the one thing in dentistry that will last the longest. A good integrated, meaning healed dental implant with a good solid restoration on top of it, along with normal cleanings, can last you a lifetime. It's truly the only thing in dentistry that we know doesn't get a cavity and doesn't fail for other reasons. So in the long run, a single implant versus a root canal, a crown, and all that goes along with it. The root canal and crown may be a little bit less expensive now, but there's a guarantee in that. It's gonna have to be replaced later. At some point, it may not be able to be fixed. So that single tooth will cost you more in 10, 15, 20 years than the implant.